name's Isabella Steinbach. I'm a genetic counselor, like Brett mentioned, at Liberty Hospital here in Kansas City. Sorry, just getting things situated here. Okay, and so I'm going to focus my talk on how genetics and hereditary factors can relate to male breast cancer. So what I will kind of touch on today are just basically an overview of basic genetics and hereditary cancer, how genetics plays a role specifically with male breast cancer, and then how genetic counseling and genetic testing also are part of that conversation. And then I would be happy to answer any questions. So first, with an overview of basic genetics to kind of give us our foundation, we start at our cells. So each of us is made up of millions and millions of cells, and each cell in our body contains a complete set of our genetic material. This genetic material is inside different structures called chromosomes. We have 23 pairs of these. And for each pair of chromosomes, we have one copy from mom, one copy from dad, which means we all have 2 copies of every gene as well. One inherited from mom, one inherited from dad. If we were to unwind a chromosome, it's basically just a long, long strand of our DNA. DNA is essentially a letter code made up of A's, C's, T's, and G's. And if we segment that DNA into particular instruction manuals, they would be our genes. So each gene is going to have that letter code to perform a certain function or make a certain protein in our body. And again, going back to how this relates to inheritance, we have 2 copies of every gene. One from mom, one from dad, and we don't really get to pick and choose what we get from mom and dad. So sometimes what we can see when we have a protein, we can test our genes if someone develops cancer or if they have a family history to see if there is an error or basically a spelling difference in that gene that then causes a protein not to work quite how we would expect. The genes we're most suspicious about in these cases are going to be ones that protect us from developing cancer. So that's essentially what our testing is looking at for any of those abnormalities. And most of the time when someone develops cancer, it's not going to be due to a hereditary predisposition. Around 70% of the time, we see a cancer arise due to sporadic random chance and not really due to anything coming down from the family. Other cases of cancer that would fall under this category are cases where we have kind of a known contributor. For example, a lung cancer that might be due to a history of smoking, a skin cancer attributed to sun exposure over someone's life. And then the next piece of the pie here is going to be familial cancers, which makes up about 20% of diagnoses. In these cases, we'll see kind of a clustering of similar or the same cancers within a family tree, but when we do genetic testing, we don't really find an answer. So there's either more we need to learn on the research side, or it's a little more complex where it's multiple genetic factors interacting with someone's environment as well as their lifestyle. So the familial cancers are a bit complex. And then in simple cases, we only really find this about 10% of the time. There's a true hereditary genetic change that we can identify on testing. Essentially, we were able to find that spelling change that's contributing to increased cancer risk. And then this is informative because we can then tell that individual's family members that they may be at risk for the same genetic change. And something that I also like to touch on is that cancer is always going to be genetic, but it's not always hereditary, as we saw on that last page. So inside of a cell, we can see this unaffected cell here on the left. we have two copies of a gene present on both chromosomes. They're both spelled the way we expect them to. Everything's working correctly. Over time, just living our lives, it's possible that one gene develops an abnormality within it, within one cell of our body. And then over time, it's possible that within that exact same cell, we don't have that other copy of the gene. It also develops a misspelling. And so if we don't have either copy of a gene able to kind of act as a defense against cancer, that's how a once normal cell can turn into a cancer cell. So these are what we see a majority of the time. Someone from the get-go, their genes are all spelled or kind of in the code we expect, and then over time that sporadic cancer occurs. With hereditary cancer, we see all of an individual's cells start out at that second step, where one copy of a gene, whichever one was inherited from mom's side or dad's side, already had a misspelling present. So it may just take less time and less chance for one of those cells to develop a second spelling difference in the second copy of the gene, meaning we may see a cancer develop a little bit easier or early on in someone's life with these hereditary cases. Some other clues for hereditary cancers are going to be when we see multiple generations or one individual developing multiple cancers, especially when it's the same or similar types of cancer on one side of the family. An earlier age of onset in the setting of breast cancer and male breast cancer, a diagnosis before the age of 50 tends to be more suspicious. That also kind of ties in with the last slide that there was just kind of less time and less chance to go by for a cancer to occur. Rarer cancers like a male breast cancer would certainly indicate a clue of a potential hereditary cancer. Other types of rare cancers are going to be pancreatic cancer as well as ovarian cancer. And then clustering of certain types of cancer. So if we saw family history of female breast cancer and male breast cancer, as well as maybe ovarian cancer, that would be concerning for a specific genetic predisposition with the BRCA1 and BRCA2 genes. Other types of hereditary cancer syndromes, we see clustering of maybe colon and endometrial cancer. So that's kind of outside of what we're talking about with male breast cancer, but over time we tend to kind of see patterns in people's family histories. Kind of talking more on inheritance, typically with hereditary cancer and male breast cancer inheritance, we will see autosomal dominant inheritance. This means that an individual only needs to have a genetic change present in one copy out of their two copies of a gene to be at that increased risk to develop breast cancer. So in this scenario, the mother has one of her copies of a gene with a change present. With each child mother and father have, there would be a 50% chance that mom passes on that gene with the change present. Therefore, here in the children down at the bottom, two of them did in fact inherit that genetic change and would then also be at risk. So when we have settings where a parent is found to have a genetic change, we can then inform them who would be the most beneficial people to test next. Often that's going to be siblings, children, and often parents as well. And we have a handful of genes that have been well characterized in their association with this hereditary predisposition for male breast cancer. We can see with each of these cancers as well, there's other cancer risks associated. So if someone has a family or personal medical history of male breast cancer, that alone would be reason enough to maybe sit down with a genetic counselor and talk about their options for genetic testing. But that recommendation would only kind of be stronger if we also saw family history of any of these other types of cancer. That would just kind of have more evidence to pile on our suspicion for a hereditary risk. Next, just touching a little bit more on testing in the genetic testing for hereditary cancer risk. Sorry. So hereditary cancer testing is going to be a little bit different from tumor testing. At the time of diagnosis or with biopsy, of a breast cancer, there will be genetic testing of the actual tumor tissue. That tumor tissue is going to be very genetically abnormal compared to a normal blood cell within our body. So tumor testing is often helpful for oncologists and other providers in the cancer setting for determining treatment options. On the hereditary cancer side, we would just get a sample of someone's blood or some of their cells from inside their cheek or saliva. And the goal with that is we're testing your normal cells, the genes that you were born with, looking if there was any abnormality present from just what we inherited from mom and dad. Part of that process is going to be the genetic counseling, providing education about what we're getting into, what we might learn. And then there's an analysis by a genetic testing laboratory that they're the ones that essentially perform that spell check of your genes, looking for any abnormalities that may have contributed to one's personal history of cancer or family history. And results take a few weeks typically to come back and are communicated to a patient, usually by their genetic counselor, so that they have a good kind of explanation of what the results mean, as well as next steps and having that support if there's any questions or next steps that need to be taken. I touched on that we would talk about possible results with a patient. So I think this is important to talk about because genetic testing in hereditary cancer settings, it's possible that we get results that vary. So genetic testing results kind of fall on this spectrum set out for us right here. On the green end, or the benign or likely benign, this would indicate that there were no variations in any of the genes tested that are known to increase someone's risk for certain cancers. This may mean that someone's cancer did arise just due to that random chance that we most often will see, or it may be in that familial setting where we may just not know what those hereditary factors are at this time. In the middle of this spectrum here, we can have a bit of a gray area. A variant of uncertain significance means that there was a variation within someone's gene that was identified, but our current knowledge of that finding is limited. So it'll take some further research over time to know if that variation did, in fact, contribute to cancer risk or if it's just part of normal human variation. And then on the other end of the spectrum, a likely pathogenic or pathogenic result is also often called a positive result, meaning we found a variation or a misspelling in a gene that we know does contribute to cancer risk or likely does. This may diagnose someone with a specific hereditary cancer condition. It helps inform us which cancers that individual may be at an increased risk for, and could help with personalizing their medical management recommendations. And so the ways in which medical management and cancer screening may be impacted are going to vary based on that individual's personal medical history, as well as their family history, and then whether any genetic change or changes were identified on their testing. These recommendations may include increased breast cancer screening, starting breast cancer screening if a male wasn't already doing that, more involved cancer surgeries, or even additional treatment options may be available for someone with a specific genetic variation. And then another big piece here would be if someone is found to have a genetic change where there is hereditary cancer risk, that individual would then be encouraged to share that information with their family members who might be at risk so that those relatives can get a better understanding of what maybe they should be doing for cancer screening and prevention. So when should we see a genetic counselor? Often people are referred when they've been diagnosed with a male breast cancer. They share with one of their healthcare providers that they have a family history of male breast cancer. A strong family history of any breast cancer may also be a good reason to see a genetic counselor because we know, although maybe there is not a male relative with breast cancer, if it is running strong within a family tree, there could be an increased risk for that male. And then going back to that clustering of breast cancer and male breast cancer with other types of cancer within the family. Listed there are going to be the pancreatic, prostate, and ovarian cancers would be the ones that are kind of more often seen associated with male breast cancer. And that is all that I have for you. I want to thank you guys again for having me, and I'm happy to answer any questions.
I got one question.
Yeah.
What age do you recommend people getting tested? I guess in my case, since I was 24 when I was diagnosed, when should I have my kids get checked? I mean, I didn't have the gene mutation, so is that needed or just in general for anybody else that's out there?
Yeah, so in the case where we do or we don't find that genetic change, at least having it on the child's radar about 10 years before that youngest age of diagnosis. So 14 would be a good time to at least start talking with their pediatrician or healthcare provider and maybe just starting like a clinical examination of the breast tissue. So when they go for their annual physical, just having the provider palpate the area would probably be a good place to start. And then from there, the provider will be able to have personalized recommendations on what they think. And then as far as testing, since most of these hereditary cancer conditions don't impact children, oftentimes the recommendation is to wait until they're at least 18 to actually do the genetic testing. That way they're able to kind of decide if it's information they'd like to learn for themselves or not. And then another aspect of that is there wouldn't really be anything we could provide for them as a screening measure during childhood. So it would
Gotcha.
also be potentially an extended period of time where they're sitting with this information without really anything to quote unquote do about it as
Uh-huh.
far as screenings.
So
That
it's pretty much stayed the same. That's essentially what they kind of told me. It was like you said, the 18, so that they can make the decision if they want to know or not, because there are people that don't want to know. They just
mhm.
kind of want to go about life. But then I was just making sure it didn't change at all. I do remember hearing that, they should start checking themselves or doctor at 10 years before, my
Mhm.
diagnosis. So I was just curious to know if it had changed or updated at all. So thank you.
Yeah, you're welcome.
Okay, and then I have a question about the Jewish community. Can you touch on that?
Yeah, that is good. I didn't touch on that. So any individuals with an Ashkenazi Jewish background may be at an increased risk compared to the general population for a genetic change within the BRCA1 and BRCA2 genes. So having that background would be a good reason to see a genetic counselor, explore the family history, and see if testing might be a good idea. And then that recommendation would also be there, especially for anyone of Ashkenazi Jewish background who themselves have had cancer or have a strong family history of breast cancer.
Yeah, that's excellent knowledge, and I know we've discussed it because Brett and I just saw Amy and everything this just October, but we still know that on all the testing Brett and I have done, We don't carry any of the mutations. We still don't know what. We've had that recent testing, but I also have 15 women cousins plus a niece at 33, all with breast cancer. And so
Mhm.
we're one of those families that there's no answers yet, but just to be
Yeah.
aware and checking yourself. So
Yeah. Even just the knowledge of family history can be very powerful. I think it also will make your healthcare providers, their ears will perk up maybe a little bit more if we're persistent with sharing that family history and letting them know that it is a concern. I think only helps in the long run.
I totally agree.